You probably already know that the firmness and rigidity of erections during sex are key aspects that give men confidence and satisfaction in those moments. I invite you to stay with me until the end of this video, where we will talk about the factors that influence penile rigidity during this stage of sexual intercourse. Hi, I'm a urologist, and today we'll explore the elements that most impact firmness, the duration of intercourse, and how they can affect your enjoyment. Don't forget to subscribe to our YouTube channel and turn on notifications so you don't miss our new videos. We know that a good stiffness can improve the quality of the sexual relationship and bring satisfaction to both you and your partner. We will talk about the factors that most interfere in this level of rigidity when it comes to sexual intercourse. It is very important that you watch the video to the end because you may have these problems. The amount of blood that enters this genital organ is directly related to the type of rigidity you experience. This amount of blood is determined by factors that promote adequate blood supply when penile rigidity occurs during erection. It is important to know that the more blood that reaches the penis, the harder the erections will be. How can you increase blood flow to the penis? A healthy lifestyle. What I mean by a proper lifestyle is one that promotes circulation in your body. This is a lifestyle determined by diet. This lifestyle is determined by regular physical activity that includes a combination of strength training and exercises to increase your heart rate. These are aerobic exercises, let's call them cardio. The combination of these exercises is the best way to improve penile and body circulation. You should also reduce your stress levels in your daily life, and getting enough sleep is essential for rigid erections. If you don't get enough sleep, you may not produce enough testosterone to use throughout the day. We know that testosterone levels in the bloodstream are essential for good erections and penile rigidity. These factors are probably the most important factors that favor the entry of blood into the penis so that you can have a rigid and very proper penis during sexual activity. We always talk about the level of arousal you feel during intercourse. The more you engage in sexual intercourse, the more aroused you will be. This will translate into a stiffer erection. What would I like to talk about? It is important to consider the overall environment. It is important that you like your partner. You have already developed a relationship with your partner, and you know that you will be more aroused. This will allow you to achieve stiffer and stronger erections. The level of arousal you feel is important, especially before sexual contact. It is important that you obtain rigid and satisfying erections. It should also be mentioned that you should try to control the level of anxiety you feel and whether or not you can control certain diseases that can affect your sexual desire. In the case of an anxious patient, for example, anxiety can cause a state called adrenergic. This means that adrenaline is released into the bloodstream. Adrenaline is the enemy of penile rigidity because it causes vasoconstriction and closes the vessels that bring blood to your penis. You will not get blood to your penis if you are constantly putting adrenaline into your circulation. This may be due to exaggerated expectation, such as fear of failing again in the next sexual encounter. This stress and anxiety can prevent you from getting rigid erections. Depressive states and deep sadness can also influence rigidity. If you are in a depressed state, you will not have the libido or sexual desire necessary to maintain good rigidity. Any illness of a psychiatric or emotional nature can also affect the quality of your penile rigidity. We must never forget the fact that certain medications can also be a determining factor in your lack of rigidity. This problem will occur if you take any medication that prevents the outflow of blood from the penis. These are mainly antihypertensives used to treat high blood pressure. Diuretics are one of them. Hydrochlorothiazide and chlorthalidone are two diuretics known to hinder erection. Beta blockers such as propranolol or bisoprolol can also cause peniles to become rigid. Also certain antidepressants, paroxetine sertraline, citalopram. These are all selective serotonin reuptake inhibitors that can affect other antidepressants too much. If you are taking any of the medications I have mentioned, you may not be able to maintain good erections, and your penile rigidity may be affected during sexual activity. We also need to address the issue of your relationship. It's okay if you can't have a healthy relationship. It is difficult to have sufficient arousal during a sexual act when you are in a bad relationship. How do you solve these problems? You have to identify the root of the problem and then try to fix it. If you are not leading a healthy life, you will have to make changes in your diet, practice regular physical activity, reduce your stress levels, change your medications, or talk to your partner about relationship problems. You can also improve your social life at this time and have stronger erections. This is what will make the difference. Correct these factors and get more blood to the penis. Blood flow to the penis is essential to achieve a firm, long-lasting erection. This blood flow can be affected by a number of factors, such as lifestyle, emotions, and medications. Blood circulation is the first factor that needs to be addressed. It is crucial to maintaining and achieving penile rigidity. The more blood that reaches the penis, the stronger the erection will be. People should adopt a circulation-enhancing lifestyle to increase blood flow. Healthy eating, regular exercise, and aerobic workouts, such as cardio, are important to improve circulation. Strength training also helps maintain muscle tone, which promotes blood circulation. These factors act together to improve blood flow to the penis. This can lead to stronger erections. Sleep is also essential for penile rigidity. Men produce testosterone during sleep, which is essential for sexual function. Insufficient sleep can lead to a decrease in testosterone production. This can affect the ability to maintain and achieve a strong erection. In terms of erectile function, sleep quality is as important as diet or exercise. An individual's emotional and psychological state can also influence penile rigidity. Mental stimulation and emotional arousal have a significant impact on the ability to achieve rigid erections. The erectile strength of men who are mentally and emotionally engaged during sexual activity is greater. Arousal is also affected by the environment and the emotional connection between a man and his partner. An intimate and supportive relationship can increase arousal and enhance erections. A positive, intimate relationship is crucial for fostering the emotional connection necessary for sexual arousal. Emotional problems such as stress, anxiety, and depression can be major obstacles to strong erections. Anxiety as one of the main factors hindering penile rigidity. When a person feels anxious, the body releases adrenaline, which causes vasoconstriction. This can reduce the blood supply to the penis and make it difficult to maintain an erection. Fear of failure can lead to a vicious cycle of anxiety. Depression can also lead to decreased relief and a lack of sexual desire. This makes it difficult to achieve the level of arousal needed to achieve a strong erection. Mental health problems can have a significant impact on sexual performance. It is recommended to seek professional help if necessary to deal with these emotional problems. Urologists also warn about the effects of certain medications on erectile functions. Several commonly prescribed medications, such as antihypertensives, diuretics, and some antidepressants, can affect erectile function. Diuretics, such as hydrochlorothiazide or chlorthalidone, can interfere with penile blood flow and make it difficult to maintain an erection. Beta blockers, such as propranolol or metoprolol, which are used to treat hypertension, can also have the same negative effects. Antidepressants, such as sertraline and paroxetine, which are selective serotonin reuptake inhibitors, SSRIs, can also affect sexual function. It is recommended that if medications contribute to erectile dysfunction, the physician should be consulted about possible alternatives or adjustment of dosages. Sentimental status also has a significant impact on sexual performance. Dissatisfaction or ongoing conflict in a relationship can lead to decreased sexual interest and arousal, resulting in less intense erections. It is important to communicate openly with your partner about any concerns or desires you may have. This will help resolve issues that may be negatively affecting sexual performance. If you correct all of these factors, I am confident that you will have strong erections. Thank you all. Subscribe to my YouTube channel, like and share this video. Give a thumbs up if this information is relevant to you. Leave your questions, criticisms, suggestions in the comments. Stay with God and see you in our next video.